Hi, I'm Victoria.
I'm Amber, and we're just going to give you guys a little bit of instructions for the geriatrics role play. We did it a couple weeks ago, so we just typed a little informational thing up for you guys. So when you're a mock patient for the nursing students, you'll be asked a variety of questions. The simulation is meant to help them prepare for real life situations, so it's important that you respond as the actual, as if you are the actual patient, and don't be afraid to challenge the nursing students either. You might be ask questions involving their environment, friends or family members in their life, their medication, and their daily life. So some examples of answers will be listed below, but it's okay to get creative. So for example, the nursing student might ask you, the patient, if they can throw away your old medication, but you can refuse to let that happen. Giving bad answers to questions like where do you store your medications can help them think of solutions on the spot while having patient interaction. And it's good practice for them to have experience handling situations that might not go as planned. So you can reconstruct answers in your own way to help the nursing students use their critical thinking skills.
Right, so a few possible student questions that you may be asked when you are an actor for the nursing students. They're going to be asking you what your name is, and this is where you can get creative. You can either use your own name or make up a fun one. They're going to ask how old you are and when your birthday is. You can obviously keep your own birthday but change the year. So we want to make sure that the patients are 65 years or older. Next, they are probably going to ask you if you know where you are. You can either lie and make it seem like you're confused, or you can just say, yes, I'm in Columbia, Missouri. They're probably going to ask, what year is it? Who is the current president? Why are you visiting us today? If you have fallen recently, if you have a caregiver or any relatives that live near you. They're going to ask if you drive yourself places or if you have someone drive you. Do you have stairs in your house or place of living? How many medications do you take a day? And do you know why you are taking these medications? Do you bring these medications with you or do you keep them at home? And lastly, do you have any reminders or alarms to make you remember to take your medication? So in the next video, we're going to be doing a mock role play, so you'll see these questions in action with real answers that might give you guys some ideas when you do it. But just as a little other pre-instruction, the nursing students will go through a bag of medications and they're going to ask you these various questions regarding the use, the dose, when the last refill was. So like Amber mentioned before, get creative with your answers. Like mentioned earlier, it's okay to give the nursing students a hard time when it comes to your medication, because acting confused and unsure of why you are taking certain medication is only going to benefit the nursing students in coming up with ways to help the patient. Okay, so this is what you're going to expect when you are in doing the role play. So I am going to be acting as the nurse because I'm the nursing student, and Amber is going to be the patient as she is the volunteer. So we're going to get started for what you're going to expect. Hi, thank you so much for coming in today.
Thanks.
We're just going to get started before we go through all the medication that you brought with us today. So what is your name?
My name is Annette.
Annette, okay, awesome. And how old are you, and when's your birthday?
I'm 72. Honestly, I can't really remember when my birthday is.
Okay, can't remember. Do you know where you are right now, Annette?
Yes, I'm in Columbia, Missouri.
Okay, good. And do you know what year it is?
2019.
Good job. And who is the president?
I think it's Obama.
Okay. And do you know why you are visiting us today?
Not really. I think just like a normal checkup or something like that.
Okay, that's good. An annual checkup. And did you drive yourself here today, or did a caregiver or a relative?
I had my neighbor drive because I got my license taken away a couple years ago. So.
Okay, so you don't drive at all?
No.
Okay. And so you don't have a caregiver?
No.
Does your neighbor come and help you out around the house?
They'll come and check on me like every couple weeks or so, but I mostly get around on my own.
Okay. and so you don't drive yourself places, so that's good that you have your neighbor there for you. Do you have stairs in your home or place of living?
No.
No? Okay, that's good. So it's a one-story building?
Yes.
Okay. And have you fallen recently within the past year?
I did last month when I was getting out of the shower.
And did you hurt yourself?
I had a sore hip for a couple of days, but I just kind of let it go away on its own.
Okay. And did you take any prescription medication?
I just took some ibuprofen.
Ibuprofen? Okay. And you haven't been to the doctor since then?
No.
Okay. Well, that's good that you came in today. So we are going to get started. I know you brought a huge bag full of your medication, which was really good, so we can go through and talk all about what you are taking. Do you know why you're taking a lot of these medications, Annette?
Honestly, a lot of them are leftovers. I don't really know what they are, but I don't want to throw them away in case I might need them in the future, and also they're really expensive, so I just don't want to throw that all away.
Okay, well, we're going to help make sure that you understand why you're actually taking these medications, just so you'll have a better understanding of why it's going to help you and when you should be taking them. And then just one more question before we get started. Do you have any reminders or alarms set, like on your phone, on a Post-it note that reminds you to take your medication?
Not really. I just kind of like keep them in my kitchen and just take them when I wake up and go to bed.
So kind of just when you're feeling?
Yeah.
Okay. So before we let you go today, we're going to make sure that we get you set up with a reminder, alarm, anything just to help you keep on track.
Sounds good.
Okay, so let's get started. Okay. So we have Advil, and how often do you take this and why do you take it?
So I take 200 milligrams of Advil 4 times a day just for pain, like in my back and stuff like that.
Okay. And you take that 4 times a day?
Mm-hmm.
Okay. Okay, and I see here that you keep ibuprofen in your bag as well. And how often do you take ibuprofen?
I take that about every 4 to 6 hours, like as I need it for my headaches, because I get really bad headaches.
And you take that with the Advil, correct? Yeah. Okay, so we're going to suggest that you take one or the other because these are pretty much the same exact thing. They're both going to help with pain.
Okay.
When you double up, you're taking twice the dose that you need.
Okay.
So we can try and focus on just taking one of those as needed for your pain. Moving on.
But I kind of feel like the Advil like helps like my body pain, and then the ibuprofen helps my headaches.
Okay, yes, and I feel that as well. The only thing is when we put them together, it is making the strength very, very, very strong, and it's not safe to be combining the two. So I would really try and stick that if you have a headache, stick with the, did you say the ibuprofen? Yes. And when you have chronic pain, definitely take the Advil. Just try not to combine the two.
Okay.
Okay. So I see that you have cetirizine. And do you know why you are taking cetirizine?
Yeah, I take that for my allergies when they get bad, whenever they flare up.
And are you having bad allergies right now?
Not really.
No? Okay. And do you know how much you take of this medication?
Whenever I do take it, I just take like 1 tablet per day.
1 tablet per day. Okay. Okay. And this I'm seeing is Bactrim. However, this is for Gerald Foley. So this is not yours, is it?
Yeah, that's my husband's, but he died 2 years ago, so I'm just kind of keeping it in case I would ever need it, but it's also like one of the last things I have of him, so I don't want to get rid of it.
Okay. And I totally understand that it's very hard to let go of things, especially from a spouse, and I'm so sorry to hear about your loss. Unfortunately, we are going to have to take this medication because it's not under your name. If something were to happen and you were found with this medication, it could get you into a lot of trouble, and it's just not safe taking a prescribed medication that's not meant for you.
Well, I don't take it. I just have it.
Right. So I think if anything, we're gonna just hold on to it, dispose of it in our doctor office. We're gonna see if we can do anything, that'll make you feel better about that. But as of right now, you cannot keep his medication, unfortunately. Okay. So next we have ZQuil. And how often do you take this?
I take it pretty much every night to help me sleep because I have trouble falling asleep. I lost the dosage cap, so I just kind of take a couple of swigs of it before bed every night.
Oh, okay. So I think, ZQuil is definitely going to help you go to bed easier. Do you have trouble going to sleep, or you just like taking it?
Yeah, ever since my husband died, it's really hard to fall asleep at night.
Okay. So I definitely suggest getting a measuring cap or a table, measuring spoon. Because
I don't even know where to get one, by itself.
That's totally fine. We can actually write down where you can get that. You can get it at Target, pretty much anywhere, Walgreens even. I'm sure we even have some in the office that you could take to go.
Okay.
Because it's really important with ZQuil, any night aid medication, that you are taking the right amount so you're not oversleeping. Okay. All right, Annette. Well, now that we've gone through some of your medication, do you feel like you understand more why you're taking them and why you shouldn't be mixing them?
Yeah, I think I do.
That's good. And like I mentioned earlier, I think we're going to help you set up an alarm system that's going to act as a reminder to take your medication, just so it keeps you on track. Does that sound okay?
Yeah.
Okay.
Yeah.
And we'll make sure that we get you a measuring spoon for your ZQuil and for any of your other medication that you may need.
Okay.
All right, Annette. It was so nice seeing you. And if you have any questions, just please let us know, okay?
Okay. Thank you so much.
Thank you.